Hey, my name is Dr. Chris Gubbels, and I'm here with the Square One Health Tip of the Week. And today we're continuing on our series. We're going over the top causes of neck pain. And today we're going over something that we see more and more. It's really common with people that sit at computers every day, people that are texting, those kind of things. And what we're going over is something called forward head posture or anterior head carriage. Now, normally from the side, your ear and your shoulder should be lined up. In forward head posture, what happens, this is when someone's head sticks forward like this, they get hunched over. This is really common when someone, it can be post-auto accident, it can be caused by changing the curve in the spine after being rear-ended, something like that. But it's really common and something that we call creep, where the spine will change into form little by little over time. And for every inch forward your head goes forward, when your head goes forward like this, the work on the posterior muscles of the spine is increased by a factor of 10. So if you have a 10-pound head and your head is 1 inch forward, instead of feeling like 10 pounds, it feels like 20. If it's 2 inches forward, it's going to feel like 40 pounds. But there's many other problems that can be associated with this. For example, headaches is something that's really common. We know there's a linear correlation between how far someone's head goes forward and how likely they are to getting headaches. Meaning, the further someone's head sticks out forward, the more likely they are to getting headaches. We know, along with that, the further their head is forward, not only are they more likely to get headaches, generally those headaches are more severe the further that head goes forward. But there's other health problems related with it too. For example, when someone's head goes forward, we know they have respiratory problems. And I'm going to cover this a little bit different. The respiratory muscles are decreased. The further someone's head goes forward, they have a loss of range of motion. So there's a lot of other things that are related to this. And so what we're going to do is I'm going to show you some of the ways we treat this. I'm going to show you how we evaluate it. I'm going to show you some of the pictures, posture pictures and x-rays, what they look like. I'm going to show you what you can look for. And then I'm going to walk you through some of those treatments. And at the end of this, I'm going to give you some of the details and exactly what we see as far as some of the negative health side effects to these exact conditions. So we're going to have my rehab assistant, Aaron. He's going to be kind of demonstrating these things. He's going to be playing the role of the patient so you can see what our rehab and treatments look like in motion. So what we're going to do next is I'm going to show you how we evaluate these things and what we're looking for in some of the problems they create. So for example, when you look at this, one thing we notice here is you can see the head is really far forward. So we're looking at the ear compared to the shoulder. So this is the classical forward head posture. In this case, it's very, very obvious. And we are going to correct this by doing the exact mirror images. So for example, the head is forward, then we're going to do exercises to bring the head back like this, so you can see she's pulling the chin in and tucking that there. We're going to go over some adjustments. We're going to do mirror image adjustments. In this case, they're pushing the thorax and shoulders forward, bringing the head down. And then we're going to do traction. We're not going to do this exact traction, but we would do a traction in the exact mirror image or opposite position, and we're going to hold it there. So this is an example of one of our patients that we had permission to show his stuff. And this right here, you can see the head is forward right here compared to the shoulder. This is the initial evaluation. If you look at the x-ray, the person's just looking the other way. The green line is normal. The red line is him. You can see his head is about 25 millimeters forward. This is also creating a loss, about 46% loss of the curve. So you can see the effect of that anterior head carriage. This is another patient. This is what it actually looks like, full details. Here's a patient when he came in. You can see, here's a software engineer. You can see his head is actually really far forward. Initially, his head was 3.94 inches forward. So his head weighed 13 pounds. Because his head was forward almost 4 inches, it effectively felt like it weighed 66 pounds. And then you're going to see it in a minute when we go through the follow-up. So a couple of other things along with this, so you keep this in mind. It's not just about posture and how it looks, but this has some huge overall health effects on the person. For example, when you have a normal curve, you should have a nice, like this, you should have your spinal cord is going to be nice and relaxed. This is what it looks like, the spinal cord looks like when you look at someone that has a nice normal curve. You can see the spinal cord is relaxed. There's a lot of spacing. This is actually looking down on the spinal cord. When that head goes forward, it pulls and puts tension on the spinal cord. Kind of like when you pull on a rubber band. It gets tension and it gets thinner and it gets weaker.
This is what it looks like when someone's head goes forward and they've lost that normal curve and it pulls and puts tension on the spinal cord. You can see it's thinner, it's weaker, it's not near as healthy. We have different phases of degeneration when we look at the normal health of the spine. So this is an x-ray of the spine from the side, and you can see this is what we call phase 1. It's actually a bit phase 2, but the neck is definitely forward. This is what it actually looks like on a cadaver. Here's the spinal cord. These are the vertebrae. These are the disc. When that goes uncorrected, we lead into what's called phase 2 degeneration. You can see you got more. These are the discs. That's a nice healthy disc. The disc has become thin. It started to degenerate. You start getting bone spurs. This is what it actually looks like on a cadaver. You can see the spinal cord. You can see what these bone spurs will start to look like rubbing up against that spinal cord. And when you lose that curve, and I'm going to show you in some later videos, when you get a reversal of that curve, the spinal cord does actually drape on the vertebrae, and you're seeing that happen right over here where the spinal cord will actually rub on the posterior part of the vertebrae and these bone spurs. And this is phase 3, where we get really severe disc degeneration, very limited disc space, severe bone spurring, and this is what it actually looks like on a cadaver. Multiple areas with bone spurring. You can see that's actually impinging upon the spinal cord.
Okay, so we got Aaron here, and he's going to show you some of the mirror image exercise we do. We always do exercise, adjustment, traction in that order, and what he's going to do is you're going to see him just pulling his head straight posterior, and then he's going to have it go forward. And so that would be like how he normally is. So he's just going to pull his head back all the way. He's going to hold up there around 5 to 10 seconds, and then he's going to get up to doing, initially maybe about 20, 30. We'll get him up to doing about 100 to 200 of these a day. And then when these become really easy, we're going to add some resistance. Okay, so now this is what we would do with someone after they've been doing this rehab for a while, and we just have some resistance on their head. And he's going to be doing the same posterior head translation, but now that we have this bungee cord on there, that actually gets some resistance, and we're just trying to strengthen these deep neck flexor, these muscles that are right down in this area and here, because the ligaments take a long time to heal, but we can get the muscles strengthened pretty fast. So he would do these in the office. He's going to do these before he ever does any treatments, before he does any adjustments or traction. And we would usually give him something like this to do at home as well. So what we're going to go over next is the mirror image adjustment. It's not the only kind of adjustment we would do, but this is to help retrain his posture. And we're putting him in the exact opposite, called the mirror image position, than his typical posture. Because a lot of people that have the forward head carriage, what happens is the shoulders go back and the head goes forward. So what we're doing here is we're pushing the shoulders forward and we're bringing the head back. And what we're going to do is I'm just going to set this, and he's going to get about 3 adjustments. I'm going to go straight down. We would do about 2 or 3 of those. And when we do those, we're not getting cavitations or that popping noise people are familiar with. It's simply to retrain his body and posture by stimulating his proprioceptors and mechanoreceptors that control coordination, motion, position, and space. And that's what we would do for the adjustments. So always exercises first, then we're going to do adjustments, then usually traction after that. Okay, so now what we're doing is we're showing the mirror image traction. This is usually the last thing we do in our office, and this is something we would do. We'd start off anywhere from 1 minute to 3 minutes, and we're going to work the patients up on this. And we're basically extending his head back. This is called extension compression. The reason we have his shoulders up is typically when someone has this kind of posture, their shoulders go posterior, so we're doing the opposite. And then we would just get him up to doing anywhere from 10 to, a lot of patients we get to doing 15 or 20 minutes. And it's kind of difficult at first, but most patients are amazed at how easy this becomes over time.
Okay, so now I want to go over a couple of just pre and post treatments. These are the kind of results we get. I already showed this one here of one of our patients down here where we brought his head from basically 4 inches, 3.9 to 1 inch forward, and that was done over about 4 months. His head weighs 13 pounds, so because it was so far forward, it actually, when we started, it felt like it weighed 66. That's what the work of the posterior muscles and tissues of the spine had to do. And then following up, when we got it down to 1, we got it down to where it felt like an effective weight of 26.8. So you can see how that would create quite a bit of pain and problems for somebody. This is actually his pre and post x-ray. You can see over here his head was pretty far forward, about 30 millimeters. We got a 96% improvement in that over that 4-month time frame. He talks about below his testimonial where it said he had went to his family's physician. He tried different chiropractor with limited results. They didn't do this kind of corrective work. And he talked about, just how well he felt, how much better his neck pain felt just pre and post treatment. This is another patient. This is someone we just recently completed. This was basically 11 or 3 months to the T. You can see his pre and post. And we do these, we make sure they're standing neutral, so they're standing in their natural state when they come in. And you can see the follow-up where his head slightly extended in the second one, but you can see how we brought him from his head being 25 millimeters forward to basically 4.7. We increased the curve of his neck, which is supposed to be 42, from to 22 back to 33, so within normal limits. That's pre and post. That was 3 days in between treatments too, so we know that's a solid correction there. And then one more, another patient we had. This just shows you another person, pre and post. This is over about 4 months. Basically got 100% of correction there. So those are the kind of results we see with the treatments we just showed you. Those are the kind of things that we predictably can do, and we can reproducibly do those over and over again with patients just like this.
So if you're out there and you're someone who's getting neck pain, headaches, upper back pain, and you think you may have this kind of condition where your head is forward, or you've never been evaluated in the way that we're showing you, just give us a call. You can actually just click on this link right below me. Just click on our website and visit our website and call and ask for a free consultation. Just say that you saw us on this video if you live in the Fort Collins area. If you don't live in the Fort Collins area, the best place to do is go to idealspine.com and look for a provider in your area. I would say first search for someone who's certified or advanced certified, and if you don't have someone with those credentials, just find anyone who's had some of the courses. But my name is Dr. Chris Gubbels. Thanks for watching in, and look for our next video.